So this is a case of 50 years male. We are planning to do the FESS, a full house FESS. You can see here, this is the right nostril. You can see the polyp here seems to be arising from the maxillary ostium. So all the sinuses is filled with disease up to frontal sphenoid also. So according to the CT scan, so our plan is to do the full house FESS. And this side, let's see our left side. So left nostril also here you can see it already. You can see the polyp here. This also seems to be originated from the frontal sinus. So let's see how it goes. So our planning is to do the full house, and here you can see the perforation, subtle perforation already. You can see small subtle perforation. So what is the basic principle of the FESS, functional endoscopic sinus surgery? The first principle is the luminization of the airway. So airway is to be clear. So here already the airway is clear up the corner here. You can see here, you can see the corner, although it is slightly, you can see the polyp here, but you can see up to nasopharynx. So that's the first principle already cleared. And second is define the anatomy. So you have to define the anatomy. So this is the, you can see the inferior trabnate here, this is the septum, this side is the septum, this is the polyp. So we have to clear this to define the anatomy. Then third principle is to clear the disease. The third principle is to clear the disease. So we have to clear the disease in all sinuses. That is the maxillary sinus, frontal, sphenoid, and the ethmoid. So we are taking the debrider and just try to debulk the polyp first. Since it is bulky, we can just debride it so that we can do the MMA. So I'm just debulking the polyp. Just debulking the polyp so that I can see the antrostomy process. So our first plan is to do the MMA and define the lateral wall, our lateral boundary. So lateral boundary is lamina papyracea. We have to define the lamina papyracea, that is define the anatomy. So first we do the antrostomy, then defining the lateral margin. First we do the MMA, then we proceed to frontal, then after that we go sphenoid, then we clear the ethmoids, then later on we do the thermectomy if required. In the left side, so left side also a little bit debulking is required since we are not seeing the anatomy properly. So we are just debulking this area so that we can see the middle meatus. We are going to do the middle meatal antrostomy. So we are just debulking this. So we have to see the pre-border of the antrostomy process. So this side also debulking we have already done. So after luminization, that was the first step. So luminization of the airway is already done. So we can see here, from here to here we have already done luminization. Now the next step is just press this middle inferior trabnate. First out fracture it, just out fracture it, and then press in with the elevator. These are the basic steps for the beginners, especially for our juniors who wanted to learn FESS. So you have to just press it here so that you can get the angle of the view. Then this is a part of middle trabnate which is polypoidal. So here also you can press a little bit here, but don't press here up, so that you can fracture the upper attachment of the middle blade. So you should be careful, you should not fracture there. But here in the down, you just press it and you can get some sound. So don't do it here in the middle or in the up. So now, once you have cleared this area, middle metal area, you have to see the ball probe, please. Ball probe. You have to see the free border of the unsnare process. So this is the next step. So next, after pressing this area, getting the angle, making the sufficient area, you just have to see the free border of the unsnare process. This is the free border of unsnare process, unsnare bone. So you have to just make it in the coronal plane. So this is in the sagittal plane. Just make it in the coronal plane like this, so that you can give a bite easily. Back biting process ready. So this unsnectomy I am going to do it. So next step is unsnectomy. So this is the back biting process. Go inside in this direction, and once you reach here in the hiatus semilunaris infundibulum, then you turn right angle into the hiatus semilunaris inferioris, and then just give a bite like this. So you have to give a bite till you get the bone, hard bone. You just give a bite, and then take your J-curate. Just give J-curate. Take the J-curate and then just slowly push it. Just slowly push it posteriorly, so that you open the maxillary sinus. Just push like this. Curve suction, please. Just push softly, don't do it hardly, just softly, and then we are already entered in the maxillary sinus. So this is the maxillary sinus, which is already polypoidal. You can see inside there is a polyp. So once you have opened the maxillary sinus, now you can use your debrider. You can use your debrider. So whenever you use the debrider, you always see the blade. This is the front blade you have to see. So this debrider is a wonderful instrument. So don't go directly there. You allow the tissue to come over there and just debride it. If you use it nicely, it's a good instrument, very good instrument. But if you don't use it nicely, it can be a disaster also. So this is the polypoidal changes here. You can see those things you can just debride off. So maxillary sinus already widened off. So this is how we do the MMA.